Hi, everybody. This is the Introduction to Counseling course, and we're going to talk today about the fields and educational requirements within the field, and this is part one. So, who provides treatment? Well, first of all, psychiatrists. Psychiatrists are medical doctors, so they do usually an undergraduate degree, and they take a lot of basic science and have to take entrance exams and those sorts of things, which is true for all of these. And then they go to medical school for 4 years, and then they do a residency of multi years. And in that, they're tested all along the way, and the emphasis is on biological treatment. Now, talk therapy is, in some places, in some ways, emphasized, but not everywhere, and not to the same degree everywhere. And the psychiatrists I know just generally focus on medication treatment. Now, this is a long slog to get to be able to do this. It's a good living, but it's not at the highest end of the pay scale for specialties within medicine. Nevertheless, it's perfectly fine as an income, but it is a long slog, and you have to be really good at science, particularly chemistry and biology and biochemistry. Okay, so the next couple of specialists in psychology are clinical and counseling psychologists. These are people with a PhD, or what some have is a PsyD, but PsyDs are for-profit graduate programs in clinical psychology. It's very hard to get licensed with a PsyD, particularly if you've gone on the internet. It's very difficult to do that. Now in California, that's a little different. You can get licensed because they recognize PsyD programs. But the problem is that it's not the same training. Now, clinical and counseling psychologists are not exactly the same. The most common PhD awarded in all of psychology is the clinical psychology degree. It focuses a little bit more on research and a little bit more on difficult, deeper personality issues and diagnoses. Counseling psychology, somewhat less so, but in actual functioning, that's not true. They overlap, 90% overlap. In terms of employment, clinical psychologists have an advantage. But these are not the only kind of psychologists you may know. There are all kinds of other psychologists that don't treat people and can't by law. Educational psychologists, developmental psychologists, experimental psychologists, and so on. Well, what do clinical and counseling psychology PhDs have to do? Well, they have to get an undergraduate degree, usually in psychology. Then they apply to grad school and usually get a master's, but it's not required, but most people do. And they usually get a master's in the same place, then they go on to get a PhD. Not all master's programs then have the availability of moving forward because the school doesn't offer the PhD. So that isn't always the case, but it's a little more convenient because then they know you and they know how you perform, and it's a bit easier, perhaps, to get into the PhD program at that same school. Anyway, the master's degree is probably 3 years beyond a bachelor's. That's 7 now. And then the PhD is another 4. So that's 10. Then you have, in order to get licensed, a 2 to 3, usually 3-year internship where you're supervised, and you take exams in oral and written exams. It's again a long slog. You can work almost anywhere in hospitals and private practice and counseling and teaching. And if you want to teach in colleges and universities, you probably need a PhD. You probably need one in some area of psychology, not necessarily counseling or clinical. You could be a general psychologist. That's equally employable in many ways. Okay, so another category is clinical social workers. Clinical social workers have an undergraduate degree, usually in social work, and they go to grad school. Some are part-time, some are at a 3 or 4 semester rapid pace. At OU, they call this the Advanced Standing Program. It's 3 semesters. And it's brutal, but it's doable. I have many students that have done that. So it's up to 3, 4, 5 years, depending on how much part-time work you do in a master's degree program. And the gold standard is licensed clinical social worker. That's the one that can get licensed to do therapy. A general MSW does not get that opportunity. Now, the problem, if you see it as a problem with the clinical social work master's degree, is you don't get very much training in how to do therapy. At least not individual therapy. You get a little bit of group and a little bit of family. So I'm biased in this way against that minimal training, and I suggest to social workers that they go to the counseling psychology department and take courses in individual therapy and how to do that. Likewise, I tell people who are getting psychology degrees in graduate school to go over to the social work department and see how you can best align community resources with the needs of the patients. Okay? So, again, for the master's in social work, you have a lot of opportunities and reciprocal licensing across the country. You can work in clinics and hospitals and social work agencies and also private practice. And despite the lack of specific training in individual therapy and counseling, they do have the license that allows them to do that. Other master's level counselors, other than social work, include things like human relations, Master of Arts in Counseling Psychology, Master of Science, and in a few cases there are still some MED, Master of Education programs, often in community counseling. The training is roughly the same, but the MS and MAs are a bit more about research, and you often have to do a thesis after you enter grad school past a bachelor's degree, and usually psychology. Okay, and then you are taking courses in those programs that align with what the individual licenses in your state require to become a licensed professional counselor, a licensed marriage and family therapist, a licensed alcohol and drug counselor, which also has its own program. Often at schools, they can get a master's degree just in alcohol and drug work. But what I would suggest you do is consider getting a licensed professional counselor degree if what you like is psychology and not social work, and stick it out for that, but also add the courses you may need to get licensed as an alcohol and drug counselor. It'll only be a few more courses, maybe 2 semesters at the most, maybe 1, it depends. That gives you a double-barreled shotgun, and you're very, very employable. And there's a lot of reciprocity for the LPC. So you've got a lot of places you can work, schools, colleges, human service agencies, and you can do private practice. Now, after you finish your master's degree, just like all of these, as I've said, you have a 2 to 3 year internship, okay, and you're supervised, and you have to take a written exam. Usually not an oral exam, but a written exam. Okay? All right. So, the LPC is the reason I recommend the LPC is it's a generalist license. You're trained to work with families and couples and groups, but you don't have a specialty license just for, say, marriage and family therapy. You have a generalist license, and it's a good license. LPC is a great license. Got a lot of force behind it. Okay? Now, you could be in other fields in psychology, so let me go over some of those. You could do biopsychology or neuropsychology. Generally, these programs are very competitive and they require a PhD. And you're working with brain injury and recovery and the biological bases of behavior. But yeah, fun. Developmental psychologist, that's generally a PhD. So you specialize in some issue or lifespan stage, early childhood, adolescence, adulthood, aging, death and dying, any number of things. Child assessment, all sorts of things that you could do. Social psychologists, they look at the group influences on behavior. They might study social bonds and prejudice and obedience to authority and cult and hate groups and cooperation and kinship and all sorts of different things. That's generally a PhD as well. as is the next one, experimental psychology, using experimental methods, learning and memory, motivation. And then we have school psychologists, and they can be master's degrees or PhD. These are folks who help teachers promote learning and social development. They do evaluations and interviews and assessments. They develop IEPs, individual educational plans. And then they talk to parents, they talk to pupils, they talk to teachers. They work in school systems. And those opportunities ebb and flow depending on where you are in the country as to job availability. But master's or PhD on that one. Then a guidance counselor, again, master's degree. Typically, you could get a PhD, but it isn't necessary. And now you're working with educational counseling in academic achievement and making career choices. You don't have to have been a teacher, but you'll do some administrative work. Again, like school psychologists, you will find job availability varies significantly from district to district and state to state. Then you come across what's called organizational industrial psychology, usually PhD. They apply psychology principles to the workplace. So they they recommend training and development, policy planning, organizational analysis and development, improving the workspace and cooperating with management to make employees more productive and happier and those kinds of things. Not many jobs around the middle part of the country in this, usually reserved for larger metropolitan areas on the east and west coast by my last look at this. Other specialists, health psychology, promoting wellness, stress reduction, might work in a hospital or at a college or university, PhD required. Forensic psychology, if you want to be a lab person or a crime scene person who does cleanup or who does collection of evidence, that could be a master's, otherwise it's a PhD. Legal issues, jury selection, eyewitness testimony, victim advocacy, that would be a master's degree. And then sports psychology, that's a PhD as well. Improving performance and handling stress. Now these last three, health, forensic, sports, generally require that you have a PhD in either counseling or clinical psychology, and then you take additional coursework. There are very few schools that specialize in these, but they do exist at the doctoral level. Okay? Do you need to go to graduate school? If you want to treat people in counseling, yes. But a master's degree is sufficient for most people in most cases. What can you do with a 2-year degree? Well, you can work as a psych tech, support role, but you can't do counseling. You could do grief counseling as a member of something like Calm Waters, which is a place for people who are grieving the loss of someone important in their lives. So you have to have a master's degree. Again, you have to go through undergrad and grad to get a master's degree. But you can volunteer at agencies and get a good taste of what it's like to do counseling with a 2-year degree. So places of employment want the kind of skills that you have with the AA degree in psych. They want you to be good communicators. They want you to be able to understand and motivate people. They want that. They want you to be able to see the big picture and to think critically. Those are all very positive things. And lots of people get hired with a psych degree in an AA program. Now, BA and BS, the undergraduate degree, you can do things like administrative support. You can teach at the secondary or K through 12, in other words. You could be a business person, a manager person, public affairs, sales, health professional, all sorts of things. So, again, education pays. The more education you get, the more money you're going to make, and the lower the unemployment rate, which means there are more jobs available. All the way up until you get into the professional and doctoral degree programs, which have better range of income and lower rates of unemployment than any of the other levels of education. So, good on you. Talk to you soon.